One of the state's biggest healthcare organizations is making workforce reductions to help with challenges they're facing with rising costs. In addition to reducing staff, Northern Light Health has also closed its walk-in care clinic on Union Street in Bangor. Alyssa Thurlow spoke to Northern Light Health's executive vice president today about the changes.
Northern Light Health announced yesterday it is cutting 308 positions across their system as it continues its financial improvement plan. Hospital officials say that number will fluctuate as they have people apply for different roles. The hospital system announced back in July they would be making changes within its system. Paul Bolin told me today 3% of positions have been reduced over the last several weeks. 2% of the reduction is made up of attrition, including retirements. The remaining 1% were notified yesterday. Their jobs were being eliminated. Northern Light says while affected roles are primarily in non-clinical areas, some patient care roles are included as part of care delivery model changes to support sustainability of critical services. Bolin says these changes are difficult but necessary, and they're working hard to make sure they find the right balance of revenue and expense.
We're not a for-profit company. Our focus is not money. Our focus is staff and patients and the community. But we need to be able to sustain ourselves in order to continue to fulfill that mission. So this is part of that operational improvement that we're making to ensure that we have that ability to be sustainable long term.
While Northern Light walk-in care is no longer providing care, Northern Light Health says they are adding providers to their primary care locations, which will increase access for same and next day appointments. We did reach out to Penobscot Community Healthcare to see how they would be impacted by this news. In a statement to us, they tell us they've been in communication with Northern Light and are deeply empathetic to the challenges they're facing. They went on to say they will work together across organizations to strengthen access to primary care. You can read the full statement from PCHC on our website and mobile app. We also reached out to Convenient MD. They say at this time they are not planning to add urgent care or primary care clinics in Bangor. However, they recently expanded to 4 providers at their new primary care location and are planning to add a 5th. We also reached out to Covenant Health and are waiting to hear